I first came to housing actually as a pediatric resident. I was in the intensive care unit, and it was then Boston City Hospital, and we admitted a child with asthma, and she had previously really well-controlled asthma. We were really trying to figure out what was going on. And for any of you that have either taken care of someone or have a family member with asthma, it's incredibly scary to see them with an asthma attack, right? You see their ribs sucking in, and we were debating whether we had to intubate this child. That's how sick she was, even on continuous medicines. And so I was kind of reviewing the chart, and I sat down with the family and I asked what had changed. And the family talked about the fact they had just gotten a cat. So any ideas of why did the family get a cat? Yeah, they found a mouse in her bed. So you can imagine this family is making this awful choice between the mice in the house and the cat probably may have been the choice that actually ended up having this kid end up in the ICU, right? And so it was such a eureka moment for me where I sat down and said, no amount of medicine I was going to give this child was going to make it okay to send that kid home, right? Like the prescription I wanted to write was a healthy home. And so it really embarked for me about this idea of housing quality. And so when I think about housing, I like to use medical analogies, right? I'm a pediatrician, and I feel like for our culture, we understand healthcare and we value healthcare. And so I often will talk about housing as a vaccine, right? That housing is something that has multiple benefits. It provides you immunity against things that potentially are going to hurt you. It gives you some resilience, right? And so when we think about that, I often will talk about a stable, decent, affordable home as that vaccine, right? And we have a lot of good evidence around that.